So if you see something like irregular pattern on ECG, think of atrial fibrillation. It's very important because it can cause turbulence, and the turbulence can lead to thrombus formation in the left atrium, and that can launch up, becoming an emboli. And if it goes to brain, it can cause stroke or TIA. If it blocks the mesenteric artery, so it can cause mesenteric ischemia. So sometimes they give you an old dude and then ask you that he has like some embolic events like TIA or stroke or severe abdominal pain referring to the mesenteric ischemia. So in that case, you should be thinking about atrial fibrillation. And sometimes they tell you that the patient is having normal hypertension and he's old and he has TIA or stroke, and you're thinking about the atrial fibrillation, and then they tell you no, on the ECG the rhythm is the normal sinus rhythm, and what should you do next? And so you should be thinking about Holter monitoring, that is ambulatory ECG monitoring for 24 hours. That can, and that can pick an atrial fibrillation pattern. And if they ask you that the patient has been diagnosed with atrial fibrillation through a regular ECG, what to do next? Think of echocardiography to see whether the thrombus have been formed or not. And the other thing is like when to give aspirin or warfarin. So that's for the, you can master it from the CHARTS 2 score or CHARTS square CHRDS 2. C is for congestive heart failure, H for hypertension, A for age 75 plus, and D for diabetes, and S is for stroke. Stroke means any embolic event, stroke, TIA, mesenteric ischemia. So if the score is 0 or 1, go for aspirin. If it is 2 or 2 plus, go for warfarin. The S carries two parts, the stroke, the embolic part. So if you see any embolic event in a patient suspected for atrial fibrillation, like TIA, stroke, or mesenteric ischemia, like something embolic event having occurred, then start go for warfarin. If even they're asking what to give to control the recurrence. And the other thing, sometimes they give you what is important: rat control, rhythm control. So ideally, rat control before rhythm control. For rat control, we give class 2 and 4 antiarrhythmics like metoprolol or verapamil, and sometimes they ask you what is the side effects of verapamil. That's very common: constipation. And for rhythm control, we give class 1 and class 3 antiarrhythmics, and sometimes they give you, we have started the patient with doflutilide or ibutilide. And what is the side effect? So with class 1 or 3, we can get ventricular tachycardias or polymorphic ventricular tachycardias, like with the class 3, that is septoportacid point. So big thanks to keep in mind with atrial fibrillation. Bye bye.